steroid antibiotic fed cow produced milk, those, on top of them, they're pasteurized, they kill the digestive enzymes. So it's like a lot of mess when it comes to our fat. And those unhealthy fat causing the inflammation. And then according to the science, this dietary cholesterol should not have any issue with the high cholesterol of the blood. But the problem happen whenever this high fat causing inflammation because body cannot digest properly, body cannot handle that. Those toxic fat or unhealthy fat causing inflammation in the artery in the heart. Whenever inflammation happen and then oxidation starts in the artery, and then then liver need to make cholesterol. The liver need to make cholesterol to cover the inflammations. The cholesterol job is to clean, to improve the damage, to help the sufferings of the cell going on. So any problem, liver need to make cholesterol. Healthy fat doesn't make any inflammation. There's no reason of liver making high cholesterol. So healthy fat makes your omega, vitamin D, vitamin K, vitamin A, vitamin E, vitamin B12. They're making all the omega-3 on fatty acid our body need. So whenever you do that, there's no region of inflamed. There will be no region of inflammation in the system. So easily there will be no high cholesterol. In the data from Harvard, they studied 300 people with a fully keto high fat diet with a plant with a no carb, and they lost weight, their cholesterol become normal. So if you have a healthy fat, if you have a high fat diet with enough fresh grown vegetables, there will be no reason of high cholesterol, high LDL.
Well, I'm Dr. Noel Boaz. I'm an MD, PhD, and I specialize in human clinical anatomy and evolutionary medicine. I'm very pleased today to have a discussion with Dr. Haque about his approach to dealing with integrative medicine and dealing with the whole patient. We have a few topics today that I think quite timely in looking at issues that patients around the country and in fact around the world are dealing with.
Correct.
Dr. Haque, it's a pleasure to be with you today.
It's so wonderful, Dr. Boaz, meeting virtually, and we're going to discuss such important topics. And it's so happy and it's a pleasure to speak with you today.
It's a pleasure to be here. Now, I have a number of topics that you've sort of indicated are of great interest to your patients, and then we sort of cholesterol is a very controversial topic now because of the issue with statins and the idea that cholesterol has a very strong connection with heart disease. And I think that it's a very interesting theoretical problem because it's just something we're just talking about with fat in the liver. Does this cholesterol in the arteries really have a pathogenetic effect, or is it an after effect of already existing damage to the intima of the arteries? So the two perspectives are, well, you're not going to have a lot of effect of high cholesterol in the arteries unless you already have atherosclerotic damage to the arteries. You have macrophages attracted to that intimal damage, and the macrophages metabolize the lipids in the blood. They become foamy macrophages, and they form ultimately calcitic deposits in the arteries, which by that point, if you already have that atherosclerotic change, high cholesterol is definitely damaging to your arteries. But they're interesting studies, and I'm particularly interested in remembering one, which was a study in the Trobriand Islands of the near New Guinea, an island called Hitava. And a colleague of mine in Sweden studied this group of people, and they have a very, very high lipid diet. they have a diet based on palm oil, and yet historically, and he started this work about 30 years ago, they had zero atherosclerotic disease, yet they had huge levels of cholesterol. But they had a very active diet. They ate a lot of active lifestyle and a very varied diet of fish, fresh fish, vegetables that they grew, and palm oil. But because of their activity levels, they were not obese. They didn't have obesity, and they had no instance of hypertension. The whole population was not. He said, "I do not agree with the hypothesis that high cholesterol generates atherosclerotic disease. I think that it's an important comorbidity that happens in Western society, particularly because we have so much hypertension, which can be related to sedentism, to high salt content in the blood, which increases blood volume, which increases blood pressure. These, in his opinion, were the critical things that create this problem with that's so ubiquitous in the West. And then the statins themselves became. We just recently had a debate in the United States about how advisable is putting 5 to 10% of the population, which is now considered to be hypertensive, on statin. Is that really advantageous? Because there's some significant side effects that are very negative there, like particularly muscle metabolism, muscles very much. And so I think that the opinion is probably still out. I mean, there's some people that disagree strongly with position, and people that all argue the other side. But I tend to believe that my colleague in Sweden was on the right track. I think that if we try to look at where this cardiovascular problem starts, it's with the hypertension aspect. And I think I would agree with you in terms of how to prevent this. It's a general lifestyle. It's a lot to do with diet. And we have to think about what our basic adaptation is. What sort of diet should we be?
Yes, doctor. I know, similar story I read maybe a few months ago. I read that the Crete is an island of Greece. So the scientists wondering how come this island never had any cardiac issue, any cardiac incident. And they went there and looked at their diet and lifestyle, and they found out that they never eat processed food. They don't have an idea of processed food. They eat mostly, as you said, freshly grown vegetable, fruits, along with enough carb and lots of fish and animals and all healthy fat. So they never have a cardiac issue. And then when I thought about our states, what do? We do a lot of fat, that's true. We do less vegetables, and whatever vegetable we have is not a fresh. And healthy fat very uncommon in here. What do? We go to the store, grocery store, get the farm raised regular fat, the meat and farm raised fish and cheese, butter, ghee made of steroid, antibiotic fed cow produced milk. Those, on top of them, they're pasteurized. They kill the digestive enzymes. So it's like a lot of mess when it comes to our fat, and those unhealthy fat causing the inflammation. And then, according to the science, this dietary cholesterol should not have any issue with the high cholesterol of the blood. But the problem happened whenever this high fat causing inflammation, because body cannot digest properly, body cannot handle that. Those toxic fat or unhealthy fat causing inflammation in the artery, in the heart. Whenever inflammation happen, and then oxidation starts in the artery, and then then liver need to make cholesterol. The liver need to make cholesterol. to cover the inflammations. The cholesterol job is to clean, to improve the damage, to help the sufferings of the cell going on. So any problem liver need to make cholesterol. Bring back into the Crete, the island, they eat only healthy fat. Healthy fat doesn't make any inflammation. There's no reason of liver making high cholesterol. So healthy fat makes your omega, vitamin D, vitamin K, vitamin A, vitamin E, vitamin B12. They're making all the omega-3 on fatty acid our body need. So whenever you do that, there's no region of inflamed. There will be no region of inflammation in the system. So easily there will be no high cholesterol. In the data from Harvard, they studied 300 people with a fully keto high fat diet with a plant with a no carb, and they lost weight, their cholesterol became normal. And when I bring back the data into our human biology and biochemistry, we see that dietary fat doesn't make cholesterol. Liver makes cholesterol whenever you have wrong fat, wrong processed food. So processed food, lack of mineral, heart, arteries, endothelial gets become inflamed. That's also causing inflammation. The liver need to make high cholesterol, and that makes atherosclerosis long term get oxidized and make atherosclerosis. So if you have a healthy fat, if you have a high fat diet with enough fresh grown vegetables, there will be no reason of high cholesterol, high LDL. As you see the science, as you see the the data and the study. So you all need to be focused on high cholesterol issue with as you said, healthy diet, lifestyle, and not processed food. But doctor, another problem is if someone get high cholesterol and they put on the statin drug, that's another problem because statin drug lowering this cholesterol, but not the solving problem. Problem was inflammation in the artery because of the toxin developed from the processed food, from the antibiotic, from the polycarbon, all the plastic bottles and the food additives. Those chemicals and toxin and preservatives come in to the artery and of course to the body as well as artery, making the inflammation. If we cut down the inflammatory food, if we support the heart not to be inflamed, get back minerals in the system. So mineralized body, no inflammation, no processed food, liver will not make cholesterol. If we don't solve this problem, only lowering the cholesterol with a statin drug, that causing further problem. And data clearly shows that 75% people who are getting heart attack or stroke, their cholesterol is normal, and most cases they are with a statin drug.
Mhm.
Because statin drug causing lower cholesterol, but cholesterol is the one needed to improve the body, to help the body problem, to help the inflammation, to help the damage caused by any sort of issue. What do you think, doctor, about that?
Well, there's no question there's inflammation there. And I think that if you can reduce inflammation, whether it be from cholesterol or whether it's from pre-existing damage that's mechanical from high blood pressure, I think it's still a complicated pathogenesis. But I think whatever you can do to reduce the inflammation is, as you say, helpful to the therapy. And we're still, I don't think we're there yet theoretically. We still need to understand what's going on with lipid and triglyceride metabolism in the body, I think. And it's complicated with the liver and insulin and glucagon and all of that. The endocrine system is complicated. It's the question that I have is primarily about the inflammatory effects of cholesterol and lipids. And I'm not sure whether that's primary or whether it's actually pre-existing damage in the arteries. But regardless, reducing inflammation is, as you say, very important. And we also know that it's important that carbohydrates or the excess carbohydrate intake is one of the biggest causes of the lipids, not eating
Exactly.
correctly. Yes, so that's been a big contribution. I think also the idea of the paleo diet, because the paleo diet also recommends high protein and relatively high fat intake compared to carbohydrate. The low carb.
Doctor, I follow a lot of research. Dr. Dean Ornish, cardiologist, another cardiologist, Dr. Cardwell, they mention their study on their own medical clinic that how high fat and high plant-based diet reduced the inflammatory marker and cholesterol level and atherosclerosis level back to normal. They have a lot of research, and I'm very impressed about those research.
It's been a fascinating discussion this afternoon. Thank you very much for initiating this, and I look forward to continuing it.
Yes, doctor, we'll talk. Thank you so much. Okay, thank you for your time. Bye.